Hello and welcome again. Now we are moving forward to in previous lecture we were here where we have talked that we will discuss this question in the next lecture. So again, welcome back. I'm Dr. Ranjit Sai, infectious disease expert as well as clinical research from the Harvard Medical School. So we were revising this, we are discussing some of the interactive question on the basis testing our microbiological knowledge, which we have read on the USMLE revision section. All videos are available in a playlist form in my channel. You can go and watch over there. Okay, so let's move over there. This is if a culture of inoculated to a density of 5 into 10 to the power 2 cells per ml at 0 time and has both a generation time and a lag time of 10 minutes, how many cells will be there at 40 minutes? So this is a simple question. If you remember the bacterial growth cycle, then bacterial growth cycle has actually 4 phases. If you remember, this is the bacterial growth cycle. This is one phase, then there is a log phase, then there is a stationary phase, and there is a decline phase. So this is your bacterial growth curve. This is a lag, this is log, this is stationary, and this is the decline phase. So in the lag phase, the bacteria do not multiply. So then the bacterial growth cycle, in the initial phase, they will preserve all the material for multiplication. So in the growth, this is the bacterial growth curve. We are in the lag phase, they do not multiply, and they have saved you that this lag time is 10 minutes. So 10 minutes they will not be multiplied. After that they will multiply rapidly, and within, they are saying the generation time is also 10 minutes. So within 10 minutes they will be double, next 10 minutes they will be again double, and then next 10 minutes again will be double. So what is your initial level? So you can remember, this is 0, then 10, then 20. So after 40 minutes they are asking 30 minutes and 40 minutes. So hope you are understanding this. So they are talking about you have 5 into 10 to power 2 as your organism which you are starting. Initial 10 minutes means lag period. There will no growth because this is the time where there is no growth of the bacteria. Only the bacteria will try to accumulate all this metabolic thing, and then they will start entering the log phase and then multiply. After 10 minutes they enter into the log phase. The generation time is 10 minutes, so into 2. At the 20 minutes there will be twice of this. Again 20 to 30 minutes there will be again twice, and at the end of 30 minutes there will be 2 times more from here, because this will be 2 times over here here. After this again 2 times, okay, and at the end of the 30 years again will be 2 times. So your net is 5 into 10 to power 2 into 2 into 2 into 2. So 5 into 10 to power 2 into 2 to the 4 to the 8, which is again equal to 5, 8 5 is 40. So 40 into 10 to power 2. This is your answer. So look in your options. There is 1.5, 2, 4, 6 and 4. So nothing is maxing except C and D. Although your answer is 40 into 10 to power 2, but this is not mentioned here. Over here they are mentioned into the answer mentioned as 4 into 10 to power 3. So you can also write this 0 can come over here, and 4 into 10 to power 3. So this is your answer, and you have understood. So the main aim of this question is to understand what is the generation time, how much time the bacteria will multiply. Initial period, the lag period, your concept should be there. The lag period, they do not multiply. So they take time, they accumulate all the food, they process all this metabolically, but at the end of the lag phase, the A come first, so there is a lag. The next phase is log, where they multiply continuously, and according to the generation time, usually the bacteria have generation time of 20 minutes. In the real, like E. coli, Klebsiella, all these enterobacteria, they multiply within 20 minutes, they become double. Here they have given you a hypothetical question, this number to understand you, to test your knowledge about bacterial growth cycle. So after that, in every 10 minutes they multiply and become double. So here till here it will be 5 into 10 to the power 2, then at 20 it will be 2 times. This will be 10 into 10 to the power 2. Okay, this again will be multiplied over here, then this will be again double at 30 minutes. So 10 into 2 to 20 into 10 to the power 2, and when you goes to over 40, then will be 40 into 10 to the power 2. So 40 into 10 to the power 2, and that is 4 into 10 to the power 3 is your answer. So hope you have understood this question answer. Now let's move over here. We can actually we can go from this, can be removed, and we can remove from here, cancel all this thing and move forward. So now we have moved to another question, and this question is: a 6-year-old girl had crashed on a taboo ride and complained of pain in the perineal area. Exams show bruising of the area. 2 days later, she developed fever, prostration, discoloration of the buttock, and blebs of the skin in the area. After admission to the hospital, she developed progressive involvement of the leg, thigh, buttock with extension to the lower abdomen. She goes into the shock and dies before surgery. So we are finding a young girl that had an accident. On an accident, she developed injury. There is a crash injury mainly in the perineal region. So there is a young girl crashed on a taboo ride and complained of pain in the perineal area. So there is a injury in your perineal area. The examinations show only bruising of that area. So there was a bruising in the perineal area only. 2 days later, she developed the symptoms. Now bruising this infection has spread all over the body. So she had fever, prostration, and this sweating is there, discoloration of the buttock. The local infection is spreading, and blebs in the skin area. So the skin infection, local infection is also increasing, and there is a systemic sign as well. The systemic involvement is also there. After admission to the hospital, she progressive involvement in the leg, thigh, buttock with extension to the lower abdomen. Now your skin lesion, that local infection is spreading all over the body. She goes into the shock and dies. So finally she dies. She dies before the surgery could be performed. So there is a serious infection that was not controlled. That was initially started within the perineum, that is spread locally as well as systemically, and this girl was died due to an infection. Now they have not given you anything about the bacterial. Now we have to find out. At autopsy, 1 inch piece of the wood is found in the perineum. Now they have given you one hint. Okay, at autopsy we found there is this wood that has been found on our perineum, which had perforated the anus. So now they have given you a source that your bacteria is from perforation, that is from your intestine. So any intestinal bacteria that can be so severe is your answer. So there are a lot of bacteria in your gut, but those bacteria that can spread locally as well as cause myonecrosis as well as cause systemic symptom is your answer. And the myonecrosis caused by the bacteria that is present inside your gut is usually Clostridium perfringens. So let's find out. Requires an elevated oxidation reduction potential, is a gram-negative coccobacilli, is a marked lecithinase producer, is a non-hemolytic in a blood agar, is non-formative. Among this, if you think this Clostridium perfringens is a characteristics that matches with this C, that is a marked lecithinase producer. Let me take you to the point to understand this Clostridium species, that is a gram-positive bacteria. And if you see we are in leprosy, then Nocardia, Actinomyces, Listeria, Corynebacterium diphtheria, Clostridium diffusion, Clostridium perfringens produce alpha toxin, that is lecithinase, a phospholipase that cause myonecrosis. And you can correlate your question to all the clinic VINAC as well as the hint given to you. So there is the myonecrosis, gas gangrene present as a soft tissue crepitus and hemolysis if heavily spore contaminated food is cooked. So there is one is food poisoning as well, and another is the gas gangrene. So perfringens perforate a gas gangrenous leg. So this was the case of a gas gangrene due to Clostridium perfringens. So you have understood here, and the answer is C. Let me move one more further, and that is a 71-year-old man is admitted to his extended care facility nursing home because of recent aggregation of exfoliative skin condition. So there is an infection that is exfoliative skin condition that has plagued him for several years. He has been receiving a variety of topical antibiotic regimen over the last 2 years. Now has a temperature of 102 Fahrenheit. The skin of the upper chest, extremities and neck show erythema with diffuse epidermal peeling and many pustular lesions. So you can find a bacterial infection that is the skin is peeling off with fever. Okay, then you have to understand, oh, this is the scalded skin syndrome of Staphylococcus aureus actually. Culture obtained. Now let's find out some of the more information given to you. Culture obtained from this lesion were reported back from the laboratory as yield as a gram-positive organism. Okay, they are lead to a gram-positive infection that is causing all this scenario, fever and peeling of your skin. This is highly salt NaCl tolerant. What lab result is used to confirm the species of the causative agent? If you remember, previously question was given the genus. They were identifying the genus, but they are here identify the species. So at the confirmation, like Staphylococcus aureus or Staphylococcus epidermidis, or say Streptococcus pneumonia or Streptococcus pyogenes, which one is the organism? Tell me up to the species level. So from this information, since the gram-positive, that is causing the skin peeling with fever, and that is actually Staphylococcal scalded skin syndrome, and Staphylococcal aureus will cause that. So when you remember gram-positive organism, so when you remember this gram-positive organism classification, so they are asking you not only this Staphylococcus, they are asking you about the Staphylococcus aureus. So what is the test? Initially, this is your gram-positive organism that has given in your question. Now you have to identify what will be the test that will leads to the Staphylococcus aureus. Obviously, catalysts will divide into the genus level only. So Streptococcus and Staphylococcus will be differentiated. But to get to this, narrow down to the species level, you have to identify the Staphylococcus, that is Coagulase, test positive is Staphylococcus aureus. So this should be answer. This should be option over here. And they are saying vaccination sensitivity, bile solubility, catalase production, coagulase production, and up to sensitivity. And we know this is the Staphylococcus aureus will lead to this coagulase production. Coagulase test is only the test that is responsible for that is leads to the Staphylococcus aureus identification. And the disease is actually scalded skin syndrome. Scalded skin syndrome, that is the exfoliative toxin that causes the peeling of your skin. So you reach the diagnosis, you have gram-positive organism, and to the species level, you have to do the coagulase test, and that is D is your answer. In this way, we can actually reach to any question answer easily. Moving forward, if you are talking about this 8 of 10 family practice resident who has a port lung for 4 days ago now have a diarrhea with abdominal cramp, general malaise, and fever ranging from 37.5 to 38, that is 99 to 100. Stool from this resident are blood tints. Laboratory study revealed the causative agent was microaerophilic gram-negative corporate with polar flagella, often in a pair, give to a seagull appearance. It grew on the special media at 42 degrees Celsius. The original contamination probably was found in. So look, they have given you a lot of information. They are actually saying there is a family who had a potluck 4 days ago now have diarrhea. So there is obviously a bacterial infection that have got due to this potluck 4 days ago, and they have diarrhea and abdominal cramp. So diarrhea, abdominal cramp, general malaise, fever is also there. There is a bloody diarrhea. So blood is in stool, and they have also reached to a diagnosis. Laboratory studies reveals cause of microaerophilic gram-negative bacteria, which the polar flagella, corv rods, and a seagull appearance. This all including they have lead you to the corv bacteria, and you know the corv bacteria are Campylobacter jejuni, Vibrio cholerae, and this Helicobacter pylori. So Helicobacter pylori doesn't cause you diarrhea. Vibrio cholerae and Campylobacter jejuni. Vibrio cholerae cause you non-bloody watery diarrhea, voluminous diarrhea. They are saying blood tints. So your diagnosis has reached to close this Campylobacter jejuni. Even they have confirmed by saying they can grow under 42 degrees Celsius. So this is 100% Campylobacter jejuni. Now they have asked you the original contamination probably was found in poultry, improper canned food, fried rice, fish, and vegetable. So they are asking about what is the source of this Campylobacter jejuni, and we know from the source of this Campylobacter jejuni. So you can see, first let's come over here. So this, if you talk about this gram-negative we are talking about, so let's move to the gram-negative one. Okay, we are now reaching to the gram-negative. So leprosy, gram-negative organism, corv rods, that is Campylobacter jejuni, Vibrio cholerae, and Helicobacter pylori. Among that grows on 42 degrees Celsius was Campylobacter jejuni. So you know the diagnosis. Now if you know about the source of this Campylobacter jejuni, then we have to actually, let me go over there and revise you so that you cannot forget about it. Okay, so we have E. coli, then Klebsiella and Campylobacter jejuni, and you can see the gram-negative comma-shaped with polar flagella, oxidase positive, grew at 40 degrees. This is a Campylobacter like hot campfire that grow in the high temperature. They cause bloody diarrhea, especially in children. Fecal transmission from person-to-person contact or via the ingestion of undercooked contaminated poultry or meat and unpasteurized milk. So your diagnosis is source is uncontaminated, undercooked contaminated poultry or meat. So you have to find out, or unpasteurized milk. What is the option there? Is there unpasteurized milk? No. There is the poultry. Yes, A is your answer. There can be improper canned food, not fried rice, no. Fish, no. Vegetable, no. Your diagnosis is improper cooked poultry or say unpasteurized milk. So A is the answer, and you have reached to the diagnosis as well as what they are asking. That is important. Thank you over here. Again, we will talk about this and again in the next lecture. Thank you.